please stay tuned and get ready. We would have a session after the guest speaker has spoken to just have some conversations around questions that you might have. Without doing much of the MC's work, I'm now going to hand over to my excellent MC, who I love dearly and happy to be doing this with today. So over to you. His name is Shayo Adebayo, and he's going to take us through the next sessions. Over to you, Shayo. Thank you.
Thank you so much, Dr. Buki. Thank you for doing like half of the work for me already. Once again, I want to welcome everybody to this webinar of Toyin Oni Foundation. Like she rightly mentioned, it's not the first, the second or the third edition it's been on. And then, like she rightly also mentioned, work has been going on for over 11 to 12 years. So we want to welcome everybody, those who are joining virtually and those who are also in this room. We truly appreciate your presence. We welcome you. So the floor is set, but then as part of the responsibility on me today is that I also need to declare this event open. So we want to commit this event into the hands of our maker, the author of our life, the one who has made sure that we see today. As a matter of fact, the one who has gone ahead of us to be sure that today will be what it is. And he had given us an assurance that this is the day that he has made, and we will rejoice and be glad in it. Please, let's bow our heads as we pray. Father, we thank you once again for life. We thank you for strength. We thank you for preservation. We thank you for your hand upon our lives. We give you all the praise and glory. Thank you for bringing this day our way. Truly, this is the day that you have made, and we shall rejoice and be glad in it. And so we commit this event into your hands, and we ask that you direct, you lead us in all that we do here today, and every conversation shall be guided by your spirit. And we covenant that all the glory and honor is ascribed to you. In Jesus' name we pray. Amen and amen. Welcome once again to this webinar. Please want to employ everyone, those who are in this room, as well as those who are connected globally, to please open up your heart and be ready to be part of this conversation. At some point, we'll also be taking questions from those who are right with us. So please would ask that you open up your heart, send in your conversations, whether you are connected virtually or you are right in this room, send it right to me, and I'll get it across to the panelists as they have that fantastic conversation. It's going to be an enlightening session. So please, let's be ready to be part of this conversation. Like Dr. Buki rightly said, I'm sure she doesn't like it when I call her Dr. Buki, but you're Dr. Buki. So as she rightly said, this work has been on for years, and then it is just appropriate for us to show in a very short clip as to what has been done over the years, as to the lives that has been touched, and many others that are benefiting from it. So please, I will ask that you fix your eyes on the screen and then just watch this very short documentary coming from Toyin Oni Foundation. Media.
Toyin Oni Foundation has a vision to raise an army of passionate volunteers whose mandate is to ensure integrity, honesty, compassion, and godly values of service are promoted. Our mission is to empower young people to stay healthy, productive, and achieve their God given potentials, also encouraging others to pursue their dreams to succeed. Our core values are trust, outstanding service, youthful energy, and nurturing prosperity. Our major objectives are to provide a platform through which successful partners can reach out to impact young people through sports and healthy activities. Another is to identify, groom, and provide scholarship and other financial aid to disadvantaged students. Another is to provide all round assistance for young entrepreneurs, startups, and businesses, as well as provide resources for growing their businesses. We would also like to advance the knowledge about health, healthy living, and as well as provide access to healthcare to medically challenged individuals. The TOF initiative. The foundation will, on a yearly basis, hold programs and community outreaches that will both celebrate the life of Reverend Toyin Oni and as well as reach out to individuals through education, medical outreaches, and entrepreneurial programs. Sports Festival. A scholarship program will also happen for intelligent students from struggling backgrounds. About TOF. The Toyin Oni Foundation was inaugurated in October 2012, a year after the passing away of late Reverend Mrs. Oluwatoyin Olubamidele Oni. This foundation was founded on the need to preserve the legacy of Reverend Oni and to ensure that her work continues to lead people along the path of service to humanity. During her lifetime, Reverend Toyin Oni had a burning passion of service to God and an unrepentant burden to add value to the lives of people within and outside her area of influence. The Toyin Oni Foundation draws its inspiration from these virtues and seeks to be a channel through which we can touch lives. The Toyin Oni Foundation is formed as a non-profit organization designed to recruit people with similar passion for touching lives and to harness their gift and reach out to thousands of young individuals who are yet to discover their true potentials. Also, to help people whose abilities have been hindered by their medical conditions. The activities of this foundation are overseen by a 6 member board of trustee and chaired by Mrs. Bukola Smith.
All right. Thank you so much, media, for that short documentary. And we truly appreciate you for that. So, like Dr. Bukola said, Doctor, you fight me today. We know you're not a medical doctor, but then we give honor to whom honor is due. She mentioned to us that the month of October is a winning researcher at the College of Medicine, University of Lagos. She has supervised the screening of 30,000 women for breast and cervical cancer in 100 community outreaches and has treated over 5,000 cancer patients. Her innovative campaigns have raised cancer awareness and reached over 1 million people. I think that deserves a round of applause. Yeah, if you are connected virtually, just put that emoji there and put a round of applause. Yes, she is the founder of Cervical Cancer NGO, a not-for-profit that conducts cancer prevention programs. She is also the founder of Onkapadi Digital Clinic. I hope I got that correctly. A tech-enabled platform that connects and empowers people concerned about cancer. She educates the public about cancer prevention through storytelling on the Cancer on the Street podcast. She is the CEO of Pearl Oncology Specialist Hospital located in Lekki. It is a 10-bed cancer center that provides 24-hour cancer care, offering quality and affordable treatment close to home. Why are you not clapping? She has emerged as a leading voice in Nigeria's fight against cancer. Her commitment to improving cancer care services and raising awareness about the disease has garnered admiration and recognition both locally and globally. With her expertise and passion, she has been instrumental in transforming, the landscape of cancer care in Nigeria and beyond. Ladies and gentlemen, please put your hands together as we welcome Dr. Omolola Salako for the keynote speech.
Good morning, good afternoon, good evening, depending on your location. My name is Dr. Molola Salako, and I'm delighted to stand before you to talk about something that is very close to my heart. I would like to say a very big thank you to the organizers of the Toyin Oni Foundation, led by Dr. Bukola Smith, for the invitation to talk about cancer prevention, early detection of cancers, because as an oncologist, what I do every day is I treat cancer cases. And unfortunately, the story in Nigeria remains very sad. And so every time we have an opportunity to help people prevent cancer, detect cancer early, it's way better than taking care of patients who ultimately may lose their lives. Please, if my slides can come up. So by way of introduction, please, can we go to the cover slide? By way of introduction, I'm a consultant clinical oncologist and a senior lecturer at the College of Medicine, University of Lagos. And there I do a lot of, next slide. There I do a lot of research at the College of Medicine, University of Lagos. But I would like to start with a lot of us who are in oncology are deeply affected, are deeply motivated, are invested till our last dying breath because we have been hit by cancer personally. And so in 2002, I must mention that I did take care of my own younger sister who had kidney cancer, lived from diagnosis till death was just 3 months. And at that time, I was a medical student at the College of Medicine, University of Lagos. I wasn't close or sensitive to people living with cancer, but after taking care of her, it became very clear and evident that I was going to spend the rest of my career in cancer care. And the first thing I did was to set up an NGO called Shebekli Cancer Care in 2006. And we've done phenomenal work in the community and we continue to do so. And then and after experiencing what patients were going through in the community, I then thought, you know what, at the time, there were just 30 oncologists in Nigeria. It would only make sense to contribute to my own career and add to the numbers. And so today we are 90, and I'm really privileged to have gone through the cancer specialty training here in Nigeria. And after becoming a cancer specialist, 2014, I believe, I spent some time in the public hospital setting, but I must tell you the honest truth. If you're a cancer specialist and you're seeing 20 to 30 patients a day, your mental health will be challenged because you not only will take care of the cancer patients, you think about their finances and many things as a specialist you shouldn't be involved in. So I stepped down from that role to set up a cancer center, which is Pearl Oncology Specialist Hospital, headquartered in Lekki. But what is unique about our cancer center is we have 3 other sites. So we identify successful hospitals that don't have cancer specialists, and we go there, set up their cancer clinic and ensure it runs smoothly. And so we're in partnership with Arjola Hospital in Bagada. We're in partnership with St. Nicholas Hospital in VI and Nigerian Navy Reference Hospital, far away in Ojo. And then just a few years before the COVID pandemic, and this is why I'm very excited to be here, because as I watched that documentary, and the Toyin Oni Foundation's vision is to help people with their God-given talent. A lot of times, people with God-given talent know it. Other people don't know it. And so 3 years to the COVID pandemic, about 2018, I just sat in clinic one day and I saw about 10 breast cancer patients, and all of them were advanced. And I said, why are we picking these patients late? Why are they finding us so late? Okay, can we use their telephone to provide information and they find us early and they can come to the hospital early, so that even if it's 100,000 naira a patient has, it's better she spends it in the right place rather than spending it in the wrong hospital and then coming to find us and she's broke. So we set up the OncoPadi app, which is Nigeria's first cancer app, helps cancer patients navigate the cancer space and find us very quickly. And of course, I'm a senior lecturer at the College of Medicine, University of Lagos, and that's where I teach the future healthcare workforce. I also conduct research. Next slide. So I'll run through these slides very quickly because I would like to stick to time, and I'll need your help and guidance in giving me some prompts at 10 minutes and 15 minutes. So It's important that we leverage the internet to educate the masses. And I was excited to go on the Toyin Oni Foundation Instagram page, and I just took a screenshot of the different messages there. So to our listeners, to our participants, I would like to encourage you to follow the handles of this foundation so that you can stay up to date on cancer screening, the benefits of vaccination, and all of that information they have on their various social media links. So I have a question, and I wish I could see the social media platforms where this is being streamed live from. I was going to ask this question, that is cancer prevention possible? Is cancer preventable? Would you answer yes or no? At the end of this session, I would want the participants to note the following things. I believe people would be aware on the common risk factors that cause cancer. Secondly, to educate participants about ways you can prevent cancer. And thirdly, be your brother and sister's keeper by sharing the information you get here. Next slide. So whether you use a device or 15 to 20 minutes, I want you to take actionable points. I will do this. I will do that. I will not do this. That's the most important thing, how you're going to apply the information you get here today into your life. And I'm hoping that at the end of this session, you will have 15 points that you personally want to take charge of. I won't bore you with the sad stories that I see in the clinic. But just to say that the way breast cancer patients present in Nigeria is unacceptable. It is so bad that a woman who noticed a breast lump the size of granite or peanut ignores it. Sometimes she doesn't ignore it. She goes to the hospital and then the doctor says, oh, we want to remove the lump. We want to remove the breast. Then all types of stories begin to happen. My husband said I shouldn't remove it. I don't have money to remove it. My body will not be complete. God gave me 2 breasts. And that's what we'll be dragging for another year until that lump becomes as big as a fist, until it bursts, it starts smelling. Maggots are coming out of the sore, flies are following, there's infection, then we're admitting this patient to treat for infection. We've spent 1 year talking about should we remove it or not. And then this woman now spends close to 500,000 being treated for sepsis. And sepsis is like severe infection. That's when the infection that started in the breast has now affected the entire body. Then after 1 year, she now says, oh yeah, doctor, I'm ready. I want to remove the breast. And it's too late. And so this is the sad story we see every day. Early detection is something people are not embracing because they have many reasons why they don't want to embrace it. I believe many of us have been affected by cancer, know someone dealing with cancer. I want to encourage you that as you interact with people dealing with cancer, the first thing you can do for them is be their listening ear. The second thing you can do for them is to help them find the right cancer specialist, because that's another problem. A lot of women go to 3 different types of doctors before they get to the oncologist. And the third thing you can do for anyone living with cancer is follow them to the hospital, be their sounding board, take notes on their behalf, because the truth is cancer care is overwhelming. Next slide. Next slide. I don't know if we all know the popular actress Angelina Jolie, who has a family history of breast cancer. Her mom had breast cancer, her aunt had breast cancer, her great-grandma, about 5 to 6 people had one type of cancer or the other. And this is a popular Hollywood actress who said, you know what, there's a strong family history of cancer in my family. Let me go and check my genes if something is wrong with my genes, because when something is wrong with the genes, it can be inherited. And guess what? When she checked her genes, what do you think she found? Was it normal or abnormal? It was abnormal. Now, when we find abnormal cancer genes, what do you think we can do? Many things. One of the things we can do that she did was she removed her breasts. Because when we find cancer genes, research tells us that that person has an 80% risk of developing cancer. And so she removed her breast, even though she didn't have breast cancer. And she reconstructed it. That's one part. The second part is she then had to go on certain medications. So depending on the family history, depending on the status of the genes, we will know which step to take. Not everybody who has a family history will develop cancer. And when we talk about family history, we are not saying the type where one person had cancer. So for example, my younger sister had cancer. Doesn't mean we have a family history of cancer. There are several criteria that have to be met before we say there's a family history of cancer. For example, Angelina Jolie is a typical example of someone with a family history. At least 5 people had cancer in her family. When they did there's still some cancers that when such patients sit in front of me, I scratch my head and I'm like, how do I begin to tell this patient that medicine has its limitations? We don't even have treatment for this. Or we have treatment and it is what science tells us is that only 20% of patients will respond. And that happens on a daily basis. But because today is about ways to beat cancer, I want you to know that 40% of cancers are preventable. And the reason why this is point one, we know enough, we have enough knowledge to know how to reduce a person's risk of developing cancer. And point two, I know this sounds weird, but there are some cancers that are kind. They actually will give early warning signs. For example, a few weeks ago, I met a middle-aged woman in clinic. She has 3 kids. And she came in explaining that she had been bleeding for 20 years. And the 20 years of bleeding early warning signs of cervical cancer. And that's what she had. Unfortunately, she had gone to a wrong doctor who removed her womb. And she presented to me and I was looking at her like, when we are treating cervical cancer, we don't start with surgery because most of our patients don't present early enough. People who can do surgery, we count them, know them. It's a highly skilled procedure called the Wetham hysterectomy. So I asked her, I said, what's the name of the gynecologist that did the surgery? She said, I don't know his name. I said, well, not only did the medical team taking care of her for the past 20 years miss the diagnosis, she was also mistreated. And that is what happens a lot in Nigeria and many low middle income countries. So my advice to our participants is, if you have any healthcare condition, research. And that's what social media is for. Speak to healthcare professionals within your family or within your network to get a recommendation of someone who has been a specialist that all they do is they treat cancer or they treat diabetes, whatever the health condition is. Next slide, please. So what is cancer? Cancer is a disease in which some of the body's cells grow uncontrollably. And if you take a look at the picture, the one at the top, you'll see that there's a normal cell that looks orange with a pink center. When the cell divides, normally it divides one, a few days after it divides into two, a few days after it divides into four. But cancer on the other side, which is color green, divides uncontrollably. And what makes it divide uncontrollably are the mistakes of the genes I talked about earlier. So the first characteristic of cancer is it divides fast. And when it divides fast, it forms a lump. It then wants to invade anything nearby. So like the example I said earlier, that a woman comes in with a lump the size of a peanut, then it bursts open and comes to the surface. That's because the lump is now invading the fat, the muscle, the breast skin, and comes out of the breast surface. And the most dangerous thing cancer can do is to leave the origin where it started from and spread to a critical organ like the liver, the lungs, the brain, and so on and so forth. Next slide, please. So common symptoms of common cancers. Unfortunately, in Nigeria, women are disproportionately impacted by cancer. If there are 10 people with cancer, you can be sure that 6 of them are women, 4 are men. And the reason is breast and cervical cancer are the highest cancers that most times occur in women. So most breast cancers occur in women. We know that women have breast cancer while some men can have breast cancer. Cervical cancer, it's only women that have cervical cancer because they have cervix. And then there's prostate cancer. So just in case someone ever approaches you and says, I have a breast lump, there are many things that can cause a breast lump. In fact, many young girls have breast lumps. It may be the innocent breast lump, it may be the cancerous breast lump. But let me just focus on this as symptoms of breast cancer. A woman presents with a lump in her breast, her armpit, or above the collarbone. A lot of times women say the lump wasn't painful, that's why I didn't go to the hospital. So a painless breast lump is the most common symptom of breast cancer. When their breast skin changes, maybe eczema, looking like rash, reddening of the breast skin, that is a concern. If the breast skin begins to look shiny, like orange fruit, you know, orange has some tiny holes on it. We call it peeled orange. A lot of women present with that. We all know that our paired organs, breasts for women, balls for men, one organ is higher than the other and one is bigger than the other. So in breast cancer, if a woman says 1 month ago or 3 months ago, I noticed one breast just started getting bigger than the other, we get concerned. A recent change, not a long time ago change. For some women, their nipples are pointing outwards. For some women, it's inward. But if a recent change in nipple position occurs, then that's something to get concerned. Unexplained weight loss. You are not exercising, you are eating your normal food, and all of a sudden you are losing weight. That's a symptom. It's usually a lot, and it just comes out in an uncontrolled way. Abnormal vaginal bleeding is the most common symptom of cervical cancer. And people will ask, by the way, what is normal vaginal bleeding? Normal vaginal bleeding is when a woman is menstruating, when she bleeds after delivery. All of that is normal. Abnormal is when a woman bleeds after sex, when a woman bleeds after menopause, or a woman bleeding in between her period. The most common cancer affecting men is prostate cancer. And it's important we educate our men about prostate cancer. The common symptoms of this condition, what we call waterworks problem, there's usually one or two problems with how a man urinates. So the first one is weak flow of urine. All of a sudden, there's a change in the way the urine flows. Like every man knows how his urine flow is. It comes out at this speed, at this velocity. He knows how to mount pressure for the urine to come out in a certain way. But all of a sudden, there's a weak flow of urine and he can't understand why that urine is not, coming out the way it should. Or there's pain or difficulty in urinating. Or all of a sudden, he's waking up at night to pee 5 times, when before he just used to pee at night once. Or it may even occur during the day where there's just frequent urination. Or he notices blood or sperm in the urine. I must mention this, that there are some other conditions that can mimic these symptoms. So when we see these conditions, it doesn't mean there is prostate cancer. UTI, urinary tract infection in men, can cause this. Men who have sexually transmitted diseases, syphilis and all of that, gonorrhea, may experience this. A diabetic patient may also experience this. Colorectal cancer, the common symptoms for this are a change in bowel habit. And I think this is one thing that is very painful for me when I sit in the clinic, is that almost all colorectal cancer patients have at least a 5-year history of change in bowel habits. Today, they are stooling. The person may say, I stooled 3 times. Then tomorrow, it is constipation. Or it's constipation in the morning and diarrhea in the evening. So a change in bowel habits, that is diarrhea alternating with constipation, is a warning sign. Finding blood in stool. In fact, if you find blood in anything that you shouldn't see blood in urine, you shouldn't see blood in your stool, you shouldn't bleed unnecessarily. If you notice that or someone tells you that they have that symptom, see a doctor. Next slide, please. There are 3 body parts that cancer has not been documented to start from. I don't know if our participants can attempt which parts of the body has cancer not occurred. Hair, correct, hair. Next slide, please. Next slide. So as Dr. Bukola Smith shared, hair, nail, and teeth. Next slide. So we have a cancer crisis in Nigeria, and those of us in the cancer centers know, and those people who have loved ones with cancer know. It is the most difficult battle anybody will face when they are diagnosed with cancer, because cancer affects all the dimensions of the person's life: the physical body, the financial implications. Family members have to take time off work to take care of their loved ones. The patient may lose their job or their business. The family members who have taken time off may lose their job or their business or may not go to school. The fight within the family dynamics, different family members out of love and care have different opinions. Some people will say, let's try this herbal method. Another one will say there's one Babalawo in Osun State, there's one in Kepi. And then some will say, let's do the orthodox care. So a lot of people, and then cancer care is expensive. And because Nigeria is a special country that we all love, and it's going through its difficult period, and we are praying for our country that God will intervene. We have high stress levels, particularly this year. We all don't even know what we are doing in our business, if we are making profit or not, because no one prepared for the cost of diesel and the PHCN tariff. And it's almost inhumane to apply that cost immediately to the patients who are currently struggling to face, to pay for the treatment that is already expensive. And so everyone is going through high stress levels, and high stress level promotes inflammation. And inflammation makes it a nice place for genes to begin to make mistakes. So whatever you are going through, please manage your stress. You all know what it's like when you get stressed. For you, it may be that your ears begins to make some noise. For you, it may be that your eye twitches, your heart is beating fast. Whatever it is, or you start sweating, whatever it is, manage your stress levels. You can control the amount of stress you go through in a day. If you are given 100% stress, can you manage 50%? Try to reduce it. It is polluted. It's unbelievable to see that amount of pollution, and that already damages our environment, the air we breathe. Whatever is being produced there, the amount of chemicals being produced from the pollution, the amount of bacteria degrading the polluted environment are just not healthy. We have a high infection rate of everything, from HIV to malaria to all the different infections. So our immunity, again, is always on the attack, and therefore our immunity is always on the defense. And we know that our immunity should have some break time. But when you live in a polluted, highly stressed environment, your immunity is overworking. Nutritional deficiencies, people are eating to fill their bellies. They are not eating to repair their body. And that is why God gave us a lot of plants, a lot of fruits, and they come in various colors and various sizes. So you should not be the type of person that eats bread and Coke in the morning, then you eat gala and Fanta in the afternoon, then eat a proper meal in the evening. What you should do is eat real food, plant-based food. When I say plants, vegetables, efo, salad, all those salad things. You don't have to eat salad, because Nigerians will say, like, what concerns us with salad? But I mean, eat carrot, eat some cabbage, add some lettuce or vegetables to your diet. Eat ugu today, eat eforiro tomorrow. And then there are a lot of superstitions within our communities. It's the wicked people that have cancer. It's the rich people that have cancer. In our family, we don't have cancer. It's only God that allows cancer to occur, and I don't want to use a certain name. Certain people are chosen to have so many superstitions that are not true. Next slide. So in 2020, 125,000 new cancer cases were detected. And if we do some mathematics, 40% of this were preventable. That means at least 50,000 cancer cases were preventable. Next slide. Next slide. Next slide. Next slide. Sugar. What you should be doing is having a balanced diet. A balanced diet is rice, which is carbohydrates, and beans, which is protein. So if you look at your plate of food, you should divide it into 4. And the 4 should have different classes of food. If you look at the English breakfast, you have bread, carbohydrates, you have eggs, protein, you have meats, you have, help me, potatoes, vegetable, you have carrot. After you finish that, they will now give you fruit dessert. So it has at least 4 classes of food. A healthy diet means the portions you eat are commensurate with what your body needs. So it's important that you eat a healthy diet. And we always say healthy diet, balanced diet. Do we know why? It is because from our mouth down to our throat to our intestines, we have bacteria in our intestines. And some of them are good bacteria, some of them are bad bacteria. When you eat a healthy diet, you promote the good bacteria. When you eat an unhealthy diet, you promote the bad bacteria. When you promote the bad bacteria, that means there's no balance between the good and bad bacteria. The bad bacteria breaks down food probiotics, prebiotics. These are food that contain live bacteria that promote the good bacteria. And a common example is yogurt. So please infuse more fruit, more yogurt, and more healthy options into your food, as well as reduce the oil, sugar, red meat. If you go to a club on a Friday and just take a look at what's happening, first of all, there's pepper soup, a lot of pepper, a lot of red meat, a lot of, not just red meat, the intestines and certain areas that really are eaten in high quantity. When that is consumed, then they move to the alcohol in high quantity, high consumption, which is completely unhealthy. Use of tobacco. People are using tobacco in different ways. Some people snuff it, some people smoke it as cigarette sticks, some people use the pipe, some people use shisha. As long as it contains tobacco, the person is exposing themselves to chemicals that are known to cause cancer. Decades ago, research was done with rats, and some rats were exposed to tobacco, some rats were not exposed to tobacco. And over a few months, the rats exposed to tobacco developed cancer. A lot of lung cancer patients have a strong history of smoking. And if a cancer patient comes in, the doctor will usually ask certain questions. Do you smoke? If the person says yes, we'll say, when did you start smoking? We want to know how many years. And some people say, well, I started smoking when I was in secondary school at age 15, and the person is now age 40 years old. So that's 35 years of smoking. Then we ask the second question, how many cigarette sticks do you take in a day? If the person says 4, then we help them calculate it. So you've been exposed to 500 sticks. And then we can also calculate their risk of developing cancer. And so whether you are directly using this tobacco or you live or chill with someone who uses tobacco, what you can do is just limit your own exposure. For example, some children will say, my parents smoke and there's nothing I can do about it. Advocate. And then if you are the smoker, there are many programs you can register for in Nigeria to, like, what do we call it? Addiction programs to reduce your consumption. If you're taking 10 sticks, if you reduce to 5 sticks, you also reduce your risk significantly. The third way you can hack cancer is to not get certain viruses. There are cancer-causing viruses, and these viruses cause infections that can lead to cancer. I call them